Come in.
Hi, my name's Emma. I'm going to be your nurse for today. I'm just closing the curtains for some privacy. I washed my hands before I came in, but I'll put some hand sanitizer on, and I'm not wearing any PPE because it's not indicated. Can I go ahead and check your ID band?
Yeah.
Can you tell me your name and date of birth?
Haley Manville, September 25th, 2003.
Okay, Haley. So I got orders today from your chart from your doctor that I have to put a Foley catheter in you today. Is that okay?
Yeah.
Okay, so a Foley is basically just a tube that goes up your urethra into your bladder, and it'll help drain all that urine that you've been retaining, and you'll feel a lot better.
All right.
I have to ask, do you have any allergies?
Iodine.
Okay, so I'll not be using that. I'm gonna raise you up. And are you able to lift your legs, or do you need me to do it?
I'll need you to do it.
Okay, so I'm gonna lower your covers real quick. I'm gonna do some peri-care, so I'm just gonna be washing your genitals for you before we start. So I'm gonna have you bend your knees up, and I'm gonna have your feet about 2 feet apart, and your knees are just gonna fall outwards, okay? Is that comfortable for you?
Yeah.
Can you hold that for me?
Yep.
Okay. So I'm just gonna do some peri-care. So I'm going to use one corner, start at the top of the meatus, go downward, use another corner, top down, and then flip my mitt. And do the middle and down. Okay, I got you all cleaned up. I'm just gonna put this waterproof pad under you.
All right.
You go ahead and lift your bottom for me.
Yes.
Okay, good. So I'll take my gloves off. Perform hand hygiene. I'm gonna put this leg band on you real quick. Just gonna go on the middle part of your thigh right here. So I have 2 fingers of wiggle room, and I'm gonna go ahead and open up my Foley kit. So my Foley kit is clean, dry, and not expired, and unopened. This is gonna go in the garbage here, and this I'm gonna keep as a little garbage bag at the end of my bed. Okay. Just gonna grab the corners and open that. I'm gonna take my sterile gloves and open those. Okay, my sterile gloves are on. I will discard this. I'm going to take this pad. And I'm going to put the shiny side down. So I'm going to fold this over and stick this under the patient. Could my aide please raise my gown? Thank you. There we go. And I'm going to take this other one. Are you okay being exposed right now, Haley?
Yes.
Okay. And I'm going to place this right here just to give me more of a sterile field. And then I'm going to take my fenestrated drape, which is not required at every facility, and I will be using this today. And I'm just going to drape it right over the area I will be working with. And now I'm going to take my tray and set it here and get all my stuff ready. So since my patient is allergic to iodine, I will not be using that. That will go in the garbage. Take the cap off of my syringe and put it on the port. I'm gonna take my alcohol, and this would be for a UA, and I would put my date time initials on it if I was getting one. I'll put my alcohol in there, my lubricant, and now I'm just gonna go ahead and break up my cotton balls. I'll be using 3. So this is gonna be my dirty hand. So I'm gonna go ahead and spread. Take my first cotton ball, clean from the top down, garbage. My second one, alcohol, top down, garbage. And my last one is gonna go right down the middle and down, garbage. And I'll discard that. Now I'm gonna go ahead and open my Foley, slowly, making sure it doesn't flail everywhere. And I'm going to let this rest in my lubricant. So now that I have that done, I'm gonna go ahead and lube this to 2 to 3 inches. And if I was using like an anesthetic gel, I would be putting it in the urethra 2 to 3 inches and putting 5 mLs of it in there and waiting 5 minutes before proceeding, but we are not doing that today. All right, Haley, we're getting ready. I'm gonna have you take a deep breath in, okay? If I was meeting any resistance, I would ask her to hold her breath and I would twist the tube, but I'm not meeting any resistance. So I'm all the way in. I'm gonna go ahead and hold this there. Inflate my balloon. Give it a slight tug to make sure that we're in. We are. Discard that. Now I'm going to discard of all of this. And I'm going to attach this on the bed below the level of the platter. And if I needed to get a UA, I would get my UA right now. Take off my sterile gloves. And I'm gonna go ahead and hook this up, the Foley band, so that way she can still have room to move around in bed if she needs to. So I'm gonna do that like right about there. And I'm going to discard of all of my materials. hard, and I would provide peri-care if needed, and I can put her legs down. Okay. A week later, knock knock.
Come in.
Hey Haley, so good news, I got an order. I can take that Foley out. How
Whoop,
does
whoop.
that sound? I
Good.
know, right?
Yes.
Alright, so I'm gonna put my gloves on. I already washed my hands. I already know who you are. I have the curtains closed. So the first thing I would do is I would put a Chuck's pad on the ground and empty whatever was in the Foley bag, and I would look at the color, amount, and any odor that was present. But since we're not there, I'm just gonna lift your gown up. I'm gonna disconnect your leg band. Here we go. I'm gonna let that fall there. And I'm gonna take my collection bag and put it there. I have a waterproof Chuck underneath her. All right, Haley, I'm gonna have you put your legs up again, okay?
Okay.
Okay. I'm going to deflate the balloon. And I'm not pulling, I'm letting gravity do it. Okay, so now that the balloon is deflated, all right, Haley, go ahead and take a deep breath for me. I would put that in my pad. I would wrap it up, dispose of that, take off my gloves, do hand hygiene, put more gloves on. If my aide could give me a pair of gloves real quick. Thank you.
Welcome.
And then I would ask her, do you want me to help you with peri-care real quick?
Yes, please.
Okay. I'd take my peri-care, I'd make my mitt. And I'd do one corner down, a different corner down, flip my mitt. And I do the middle down. Can take this leg band off of you. Put your legs down. Cover you back up. And put the blankets back on ya. Remove my gloves. And perform hand hygiene. I'm gonna lower you back down. Now I would exit the room and perform hand hygiene.